As healthcare professionals continue to seek greener pastures abroad, the Nigerian healthcare ecosystem has suffered in terms of understaffing and poor healthcare delivery. And joining us in studio to discuss the subject matter is Comrade Eddie Chuka Ohekwiro. Comrade Ohekwiro is the immediate past Public Relations Officer, National Union of Allied Professionals. Comrade, you're welcome.
Thank you very much.
Thank you for making out to be in the studio.
Thank you. Thank you.
So we are talking brain drain, and in our local parlance, the Japa syndrome.
Yeah.
How has it affected the healthcare and allied professionals? Just a brief overview of the trend in you.
Massively. Massively, has affected us massively. Remember, brain drain is just peculiar to the health sector. It's a general thing, but just that it has drained the human resources in health badly, and with replacement. And the next alternative is near death. So the health sector seems to be at the focal point. So it has affected us massively. The exodus of people is unprecedented. And the replacement is nowhere to come about, because as people are even graduating, their mindset is targeted not to work for Nigeria, because Nigeria seems not to be working. So you do not hold people back when you don't provide them with the necessary things they need.
Okay, so a system that is a form of a replacement. Could you elaborate on that? Why a system that replaces once these professionals leave?
You see, what could have necessitated replacement should be better working environment, security in the system, better pay. Migration is just like osmosis, moving from lower concentration to a place of higher concentration. Higher concentration could be better environment, better pay, better equipment. In Nigeria, you see frustrating health personnel. Frustrating in the sense that you know what to do, but you don't have the capacity to do it and save life. So it doesn't give you job satisfaction to retain in the system. So people leave for various reasons. Okay? There are people who you see a system where you know what actually to do for this person to continue to live, but you don't have the equipment to do it. So why will you remain in the system? It's frustrating. So the replacement could have been a situation where people leave probably to get more knowledge, and you see younger people who are graduating that will want to replace them. But we don't have that, because you don't have the ability for the government to send you for outside trainings that could have necessitated a replacement for you till you come back. So people just fund themselves outside, and so the ones that are coming in do not even want to land in the system. They just go away.
So what are the major consequences of this Japa syndrome and the brain drain in our country?
The major consequences is that it has increased the mortality rate in Nigeria. That is the major. The mortality and morbidity rates in Nigeria have increased, significantly.
One of the newspaper headlines today stated that doctors are complaining of the high electricity tariff, that patients are dying. What do you think the government are doing wrong in this aspect?
You see, the general economic meltdown is affecting every sector, and it's hitting us badly. Because situations where you need energy to sustain equipment that could sustain life, and those energies are not there, the direct implication is that you lose the patient. That is the direct consequence. Okay, so these are energy. I want to also commend the president that recently tried to, ensure that the local governments get autonomy, because that also has an overreaching effect on every sector, including the health. Because if you have a system where you have a local government chairman who is interested in improving the health of his local people, he will have the funds to do that. But you could have a system before now where you have somebody who have what it takes to improve the health of his people, but he doesn't have the funds.
All right, Comrade. A while ago, we had Comrade Ben Asawa come into the studio to talk to us, and he was reiterating so many aspects where the professionals in the allied and health care sector are finding it worse off than their counterparts in the medical sector. Do you think this issue of brain drain affects those in the allied healthcare sector much more than it does the medical doctors?
It affects virtually everybody. We are the worst hit.
How so?
The reason why we are the worst hit is that go and check the professions. You find out that most of the professionals in our union do not necessarily need some level of certification examination outside before they go. So the road is very clear and smooth. For instance, check physiotherapists and other people in our union. They don't need any certification. They are wanted. So they are not like other professions who will need to write this exam or write that exam or go there and even start afresh. Ours is just exodus, movement. So you see that the way people are living, in fact, people that are now there are either because they've not had the opportunity to leave or one family issue or the other is weighing them back. Otherwise, the exodus is massive.
Okay, so let's now talk about the policy the president signed into law.
Thank you.
That he said medical personnel, experts shouldn't leave the country. They will make. What's your take on this?
Well, we have been with Nigerian government for long. We know how they operate. Most of these good policies have sinister moves, sinister undertone, hidden in it. Government, it is good that government is saying that we'll make, life good for the health workers, we'll pay them well and this and that. But that's not the true situation of things they want to do. Go and look at that policy. There is somewhere in that policy where it's saying that, 1:1 replacement, so that if any foreign country is taking one, you replace one. It's just a way to make sure that you stop forcefully health professionals from leaving. Not that you're providing them with what they need. The Japa syndrome is not just an intra-Japa syndrome. There is also inter. The inter, I mean, local government health workers want to Japa from local government and come into state.
Yes.
Why? Because the state pay well, better than the local government. Those in the state want to Japa from state to federal. Why? Because the federal pays well. There are people who are currently not even paying the Conhes system structure, salary structure, to their local people, to their state people. Within the states, you see people who want to leave the state Ministry of Health and migrate to the teaching hospital. For instance, the 2009 salary structure that was signed by President Yar'Adua was 10% of it was implemented by the then government of Sullivan Chima in Enugu State. 60% of it was implemented by the then Ugwuanyi's regime. It's just this current governor that have signed into law 100% yet implemented. It's not yet implemented, but he has signed that it will be 100%. This is 2024. It was signed in 2009. So why will people stay? I sincerely do not think that this government, Nigerian government, prioritizes the health of its people.
Actually, what are some of the things you feel are cogs in the wheel of development in terms of pay packets in the health sector? Why does it take so long between policy formation and policy implementation?
Willingness.
I understand.
The political willpower.
Okay.
One, and corruption in the system. You see, the politics we practice does not support learning. A system where you have the minimum entry into politics is secondary school education, and you become a legislator, and you'll be legislating on the salary structures of people who have gone to universities and the rest of them. You don't understand. Okay, you check the salary of a health worker, average salary of a health worker, put it side by side with the average salary of a legislator. So it doesn't support learning. That is number one. Number two is that political class, because they are not patronizing the health system we produce in Nigeria, are not interested in making it formidable. When a senator, a House of Rep member, a governor, a local government chairman is sick, he japas to go and receive treatment. So tell me how that person will invest in the system. You saw what happened to us in COVID. We are virtually left with nothing. We could not manage it until we had foreign interventions because we have left our backyard so porous that we do not have anything to sustain emergencies. So that is the situation.
Do you think there is something that both the private sector and the government can do to curb this menace?
Yes. If the government has the willpower, there are where they can draw sustenance. For instance, the National Health Insurance Agency could have been a very good system, which if the government harnesses and insulates it from the regular corruption in the system, could have been able to a very large extent, sustain the health. Health insurance is all about, socioeconomic status of everybody. You pay the much you can afford and get services the much you need. There are social factors. This phone is a socioeconomic status. People recharge according to what they can afford and use what you see. You can target into that, you can capture into that, and make sure that people pay according to what they can afford and also get services the much they need.
Does that have any direct impact on the pay package of the health worker that will make such a professional not want to, travel
I have told
out?
you that it is not only pay package that makes people leave. Availability of equipment, materials. Go to the hospitals. Just take a look to the hospitals. Hospitals lack basic things they need to use to support life. You see the incidence of slump and die is trending. But there are things people could have had, including training, common CPR, that everybody should have the knowledge about. They don't have it because, it is not as if it is rocket science to get people trained, but it is not a priority of government. So what I'm saying is that health insurance could actually make some of those things available, including the funding to provide those things, insulated from corruption anyway. I said it had been an issue. Because if you're not insulated from corruption, it will still go down the way most monies that have been saved, including our pension, is going down. So we need to insulate this thing and have the commitment, patriotism, to get things working in this country. It's unfortunate that things are not working.
Okay, of this trend of where people tell you that when you are sick, it's better to go to a private hospital than to a government hospital. Does this thing affect the private too? And how come they have much more of equipment and probably better pays than the government sectors?
That is why I say corruption is a key factor. A situation where a private individual can get things. And it is not just in health.
Yeah, of course. Yes.
It's just not in health.
Yes.
Nigerian refineries are down.
And
but a private individual just floated one. So it is corruption in depthum. They say corruption profundus. So corruption is in depthum, and we need to weed it out. If we don't, it will kill us. That is why a private individual can afford to have the equipment you need. Meanwhile, that person could also be working in a government institution, and yet the ones he's working with are not functional in the government institution. But when you go to the private, it works. So it is just a way to, make government not to work for the people, because health is one of the social contracts government has with the people. And if you're not fulfilling that, your life expectancy will continue to drop.
All right, comrade, nobody is out to reinvent the wheel. Are there some best practices, strategies, or models Nigeria can actually look to and adopt and adapt into Nigeria to curb this issue of brain drain?
Yes. There are systems that are working.
Could you share with us?
Where are people migrating to? What are they migrating there for? Politicians even know better than me what you're discussing, because they know where they go to receive treatments. Make those things available in Nigeria. I can comfortably tell you, with the increase in electricity tariff and all of them, basic health care have eluded the financial grip of most people in Nigeria. So it's frustrating. So Nigeria government and other government can reinvent. They can actually look at how do you make these health workers work. I learned that the governor of Ebonyi State is doing something like that. He's looking at people who do not want to leave the system, and he's providing them with enormous things they need, including getting them vehicles and the rest of them to make life easier for them. These are things government could do for health workers. Why are they leaving? Most of them are leaving so that they can be able to provide shelter for themselves, having watched their bosses retire into oblivion. So you better leave when you're young. Okay? When the people that are working knows that government has their interest at heart, okay, that when you age, by that time you age, some sicknesses that come with aging will start coming, and you do not have the resources to pay. It becomes a worrisome thing. Then you have to leave on time to make hay while the sun shines. So government can actually sincerely and honestly, not signing policies into policy that will clamp down people forcefully. You can't. People will resist it. Definitely, this is democracy. Okay? But if you sincerely start improving the well-being of health workers, you can start from the inter before you go intra. make sure that the CONHES payment is cut across every health worker. That the local government, that the guy working in the rural area is receiving the same pay the guy working in Abuja is received. So the guy in Abuja will also see that cost of living could affect me more. Let me go down to the rural area and work. That is, if you start doing that, then we know that you're committed in doing those things in those policy documents.
Wouldn't that be a constitutional issue?
No, how will it be a constitutional issue? We have what we call minimum wage. It's supported. Okay? If we have minimum wage, then those things can be negotiated. Meanwhile, the president has the powers to sign executive orders to make sure that, because you want to make sure there is no health crisis in your country. So it is not out of the place for a president to sign executive order to sustain such things and also fund it.
Okay. Chigi, you said you wanted to ask about the government having to work in Abuja and having to work in the rural area.
Yes, I was going to talk primary healthcare. We can only imagine the burden of this brain drain on grassroots, healthcare. So what are some of the things that local governments recently have gotten their autonomy, although it hasn't been fully implemented yet, but what are some of the things that the local governments can begin to do at grassroots to ameliorate the impact of brain drain?
Every patient that comes to the tertiary institution comes from a local government. And if those primary health cares are functional, the tertiary system will only be taking referrals. Go and look at most tertiary hospitals. They are doing the work of primary health care because they are lacking. I don't want to mention any local government, but it cuts across. There are no doctors in our primary health centers. There are no nurses. There are no supporting staff. No ambulance in the whole local government. So, but I believe that if we start doing the proper thing, if we start allowing the people to choose their leaders and their leaders becomes accountable to them, you'll be able to get leaders who will know the pains of the people and solve them.
You are the immediate past PRO of NWAP.
Yes, Nigerian Union of Allied Health Professionals. Yes.
Is there anything your group is doing to actually mount pressure on government to improve not just the pay package, but most of the things you mentioned to close some of these gaps? Has there been any pressure on government? Because we understand with trends in Nigeria, government doesn't give you anything on a platter. You have to mount pressure. So has there been that sort of pressure on government? And can you be specific about that?
Yes. The unions are mounting a lot of pressure. But government and their way. We are mounting pressure. For instance, aside my core union, you see the joint union coming together the other day to mount pressure on government to pay subsidy on the electricity or health, on the tertiary health institutions. These are one of the things they are doing. We, on our own, Nigerian Union of Allied Health Professionals, are also mounting pressure to see that those packages that our people are getting abroad, that is attracting them, those higher concentrations, is it possible for government to make it available? In Enugu State here, our union also mounted pressure to see that the governor implemented the CONHES 100%. This will also ameliorate the level of departure of health workers. I commend the governor for immediately signing that 100% CONHES, but he has not been paid.
Has it been gazetted?
Yes, he has been gazetted, but he has not been paid. What we understand as implementation is when our people receive the money. When we receive the money, we know that you cannot easily take it back. But if it stops at paper and the rest of them, we consider it not being implemented. But I congratulate the governor for taking that leap to sign 100%. From 2009 to 2024, it's remaining 5 years, it will become a decade or 2 decades or thereabout.
If this continues with the way governments are going, what do you think is going to be the consequences on the healthcare sector and even Nigeria as a whole?
The health system already is nosediving. In 1985, we are 57th. We are ranking 57th out of 191 countries. Well, now we are 187. Currently, we are 187. Only better than 3 countries or thereabout. So, what we need to do, the problem actually started from 1985. Otherwise, we are increasing. There was a time when people come to Nigeria from high-class families. The princes and the princesses, the kings, come to Nigeria to seek for healthcare. But it nosedived when the military took over in 1985 and did so many things wrong. But it is left for this democracy to start retracing their footsteps and getting things right. I have told you the WHO ranking. In 1985, you can check it, we are 57th out of
in the world.
Oh, yes. Today, we are 187th. I don't know what you can rank it if you're a lecturer.
All right. Comrade, you mentioned there are a couple of professions under your union. Can you mention some of those professions and then mention which of the professions have the most tendency to, suffer this brain drain?
We have medical laboratory scientists, we have pharmacists, we have radiographers, physiotherapists,
Okay.
dietitians,
Okay.
all of them, health information managers.
Okay, non-clinical health.
Yeah, we have
professions.
clinical health professionals
Okay.
in our union. Everybody has the capacity to migrate because you see what is happening outside the country. We are like a system that is producing health workers for the others.
Exportation.
Yes, and we are starving in the midst of plenty. We produce, but they don't stay because we don't have the capacity to keep them, and they leave. So every profession under our union has the capacity to move. The only thing I have told you have been issue is that one factor or the other that I do not see, it could be minimal patriotism, because patriotism comes when you see that the leaders are leading by example. Not when everybody is like a butcher with a hack knife trying to get his own portion. So why are you there?
Yeah, you mentioned something interesting. You said our problem started in 1985.
Yes.
That was talking about a particular decree.
Yes.
A policy, a healthcare
Yes.
policy. Can you elaborate on that and tie it around why it is causing brain drain, decades down the line?
Thank you very much. You see, we used to have a system where we have the core administrators manage the health institutions.
Please,
in 1985,
break it down. Break it down so our viewer can understand
in
what you mean.
1985, they were called hospital governors. These are people go abroad, go to United States, go everywhere. You see people studying hospital administration and management, health administration and management. These people are core administrators managing the health system. So you now have clinicians, you now have medical lab scientists, you now have doctors, you now have pharmacists come to work where they manage. You understand? It's like, a hotel, you have the hotel manager. Meanwhile, there you have the cook, you have the hospital, everybody there. But he manages and oversees everyone and makes sure they are working. But His Excellency President Babangida came in and drove them away and closed that office and invented the office of the Chief Medical Director. And it became a birthright for the professionals, the doctors. So that's what killed the system. So many people, were also ready to work in a system where they don't know when they will rise. Because not this person, you can never get there.
So you're saying the disenfranchisement also contributes to
Massively. Massively. It contributed. Could you in a situation where in Nigeria where you say that only those who studied political science can be in the president of Nigeria? What happens to all those contributions brought in by those who are Botany, Major, Obasanjo, who was a military man, and other? What happens to those contributions? So you have a situation where you are pinned down and you want to remain there. You leave. The director general of the WHO today is not a medical practitioner. You can check that. So these are factors. Like I told you, it's a myriad of problems, but we can start one and solve it gradually till we get there.
Of course, when we speak dichotomy that happens between the doctors and you're speaking of how only now the chief medical directors, of course. Do you think plays a factor in nurses leaving the country?
Yes, it does. Huge. Okay, because there is no way nurses, yes, has its own humble beginning.
Yes.
Okay, even medicine started as a diploma course until it became a graduate course, postgraduate, and the rest of them. Nurses also, and they have graduates who also now have the capacity to administrative capacity abundance there. But if you pin them down and say that they will never grow, it becomes a problem. And if you don't also encourage them to go on in-service trainings, it becomes a problem. Nobody wants to remain stagnant in life. No, everybody wants to.
Finally, before we let you go,
can
you give us solutions to these things, possible solutions or policies that can be put in place to curb this?
Yes.
Please hold that thought. I have something. Is there any collaborations between diasporan healthcare professionals and those in Nigeria? Is there any platform at all that brings those in the diaspora and those in Nigeria together?
It's always those collaborations seems to directed more on intervention on the rural people or people who might not be able to afford certain care. Okay. It's not a formal informal interaction that leads to policy changes, because it could be difficult for somebody abroad to come and affect policy changes here. We are the people doing it, but we still have exchange of ideas that could be used at every point in time to reform our own policy. But there is no formal. But there's still people who are there still back here, to find one intervention or the other to sustain the rural dwellings.
All right, finally on some of your suggestions on the way forward.
Yes. Yeah, government needs to be sincere, okay? And probably bring every profession in the healthcare to a round table, and we discuss a way forward. We can invent a new policy that will make everybody be at home and be patriotic and build the Nigerian health system. It's a team. No one profession can do it alone. Down to the cleaner is into the health system.
All right, thank you so much, Comrade Eddie Chukwemeka Ohekwiro. It's been insightful. It's really educating having you come into the studio to do justice to this topic. So thank you.
Thank you very much. Thank you very much. Thank you for having me.
Yes.
Thank you.
All right, if you're still new day, don't go anywhere. Don't go any. And when we come back, the